For the first time, the American Cancer Society is recommending some high-risk women get MRI screening in addition to a mammogram, as MRI can detect cancer mammography misses. The ACS estimates that this would help around 700,000 to 1.3 million women, most of whom have had a first-degree relative with the disease. Joining us from Boston is Dr. Erica Mayer. She's a breast oncologist at the Dana-Farber Cancer Institute. Welcome and thanks for joining us.
Thank you very much for having me.
Dr. Mayer, what should all women be doing to monitor their breast health?
In general, for women who are at normal or standard risk of developing breast cancer, the official recommendations are to get an annual mammogram and to visit your doctor regularly for a clinical breast examination.
And are there factors that put a woman at higher risk for breast cancer that they should be aware of?
Some of the traditional factors that we look to identify women who are at very high risk of breast cancer include a striking family history of breast and/or ovarian cancer, or women who've had health conditions in the past which could predispose them to breast cancer, such as a history of Hodgkin's disease or of receiving radiation therapy to the chest wall.
Now, should all women now include getting an MRI as part of a breast cancer screening? Should this become standard now?
Well, I think the importance of the recommendations from the American Cancer Society is that they highlight that we've made a lot of advances over the past several years in trying to find better ways to screen for breast cancer in higher risk individuals. We do have data from clinical trials looking at women who carry gene mutations that can predispose to breast cancer, the BRCA1 and 2 genes, that have shown that MRIs, in addition to standard mammography, can be quite helpful. And thus, for those women who carry those gene mutations or for whom their doctors think are at very high risk of breast cancer, should be considering getting an MRI in addition to the standard mammograms. If a woman is not sure if she falls into that high-risk category, it is important to meet with your doctor, review your family history, and even consider a consultation with a genetic counselor to better determine if one falls into that high-risk category.
And we know that most traditional insurances do cover mammograms now for women. Do we know that now, if this study's come out, if MRIs are going to be able to be included as well?
I think that information is not completely known at this time, but we do use MRIs on a regular basis as part of screening and also evaluation of patients with breast cancer. And to date, in general, MRIs have been covered by insurance companies.
Dr. Mayer, for women who have already caught breast cancer in one breast, how common is the occurrence of cancer in the opposite breast?
We do know that for women with a diagnosis of breast cancer on one side, they are at a slightly increased chance of developing breast cancer on the other side. However, the chance overall is relatively low.
What was your reaction? I mean, recently, of course, there's been news of public figures announcing the recurrence of their cancers. We had Tony Snow, we had Elizabeth Edwards. Elizabeth Edwards, obviously a breast cancer survivor. What was your response and reaction to the fact that it moved to her bone? Is that common?
Unfortunately, in a certain percentage of women who are diagnosed with early-stage breast cancer, they can experience a recurrence of their breast cancer either within the breast itself or elsewhere in the body, as what's happened with Mrs. Edwards. Whether a breast cancer is going to come back depends on many individual factors relating to the tumor itself and other aspects of the care. Personally, I'm very much struck by Mrs. Edwards' courage and her strength in coming forward with her new diagnosis, and certainly everyone at Dana-Farber wishes her all the best in starting her new treatment plan.
Of course, I think everyone in America wishes her the best. Dr. Mayer, obviously she came out and said that she detected that extra bump and when she went to the doctor because she had a fractured rib, a cracked rib. How better can women go out and take these precautionary steps to detect such things?
Well, her situation is a little bit different than all American women in that she is a breast cancer survivor and has been monitored closely by her doctor. For women who do not have a breast cancer diagnosis but who are interested in doing everything possible to try to see if they have breast cancer or make sure they don't have it, again, the standard recommendation would be to get your mammogram every year and to follow up regularly with your doctor for a breast examination.
And are we seeing more recurrences of breast cancer being detected in women? Are there certain patterns that you're seeing and detecting now that maybe we weren't just 10 years ago?
I think the trend nowadays is recognizing that breast cancer is not all one disease, but is actually quite heterogeneous, and there are many different subtypes of breast cancer, some of which recur in patterns which are rather characteristic, and others tend to have different patterns. And so we're learning how to recognize these patterns, and that might actually influence the way we monitor women.
Okay, well, we appreciate your time, Dr. Mayer. Some great tips you gave us there.